Hi guys, so today my topic of today is about the loop diuretics. So like I told you last time, diuretics has many there are many other topics under diuretics. So today we're looking about the loop diuretics. These drugs inhibit reabsorption from the loop of Henle in renal tube. They're primarily used in medicine to treat hypertension and edema, often due to congestive heart failure or renal insufficiency. There are some drugs to be given if you have this issue. So there are some drugs which is Frusemide, tablet and injection, bumetanide, which is a tablet and injection, Frusemide, which is also as tablet. Frusemide is the main drug of this group. They act within 1 hour of the oral administration. If you administrate it, after an hour it will react. Therefore, it should be given in the morning or in the evening, not at night, because this will be a disturbance for your sleep. And also, when you take Frusemide, there will be loss of potassium, therefore it should be taken with the KCl tablets. It is used to treat high blood pressure. It is also used to treat edema, which is swelling caused by fluid build-up in your body. There are many side effects which can occur with Frusemide, which is nausea or vomiting, diarrhea, constipation, stomach cramping, vertigo, headache, blurred vision, itching or rash. So these are the side effects, the common ones which happen. So you need to you can take it in consideration, or you can just think that this is because of Frusemide, which is not a really big issue. Drug interactions. There are some there are many drug interactions with Frusemide. There are many groups. So antibiotic will go by the groups. So antibiotic, they can increase your risk of hearing damage or loss when you take it with Frusemide. There are drugs which is amikacin, gentamicin, neomycin, tobramycin. Anti-seizure drugs. Taking drugs with Frusemide, taking this anti-seizure drugs if you take Frusemide with this anti-seizure drug, this can decrease the effect of Frusemide, which is phenytoin. Cancer drug. Taking this cancer drug with Frusemide can increase risk of your kidney problems and hearing damage or loss, which is cisplatin. Taking this cancer drug with Frusemide can decrease the effect of Frusemide. Also, Frusemide may increase the amount of this drug in your body, which can increase side effects, which is methotrexate. Then, immunosuppressant. When you take this drug with Frusemide, can increase your risk of arthritis, which is cyclosporine. Taking certain muscle drugs with Frusemide can increase the risk of this drug. This rises your risk of side effects. Then there are some other blood pressure drugs as well. Like if you're taking other blood pressure drugs with Frusemide, this will drastically drop your pressure level, which is also dangerous. So there are drugs which include this, which is benzapril, captopril, enalapril, lisinopril, perindopril and ramipril. So these are the drugs when you take with Frusemide can risk your pressure level to very low level. Pain and inflammation drugs. So taking NSAIDs with Frusemide also can increase the level of these drugs in your body. The rise of your risk of dangerous side effects, which is aspirin, indomethacin and magnesium salicylate. So this should be taken into consideration. And if you are taking these drugs, if you're taking any of these drugs, your doctor should know that you're taking these drugs, so that he he will take in consideration, and if the doctor prescribes you Frusemide, he will know what he should do when you're also drinking those drugs. So there are some general things you should know, you should take in consideration when you're taking in Frusemide. When your pharmacist tells you, you should take this in consideration. I hope all the pharmacists give you all the directions when you're taking a tablet. So Frusemide, when they're actually dispensing, so Frusemide causes you to urinate more. So this drug shouldn't be given at night because it will be a disturbance for your sleep. And you shouldn't crush or cut this Frusemide tablet. So that's all for today. Make sure to hit up the bell button so that you will be notified in my next video, and do not forget to like, share and subscribe to my YouTube channel so that this will be useful for you all. And don't forget to share this video because if anyone is drinking Frusemide, this will be useful for them, because sharing is caring after all. So this was for today, and do not forget to watch my next video, which will be more on the diuretics, the topics of the diuretics. Stay tuned for my next video. Thank you.